a questionable warning and, frankly, directive from President Trump just moments ago, as well as his top health officials from the White House. The president saying, quote, Tylenol is not good. Don't take it. For a little bit more of what we are hearing on these announcements, let's listen.
Effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good.
The president there just moments ago, as you heard him, alongside him, HHS Secretary Robert F. Kennedy Jr., as well as CMS Administrator Dr. Mehmet Oz and others, all claiming as well there is a link that they say they have found between autism in children and the pain reliever acetaminophen, of course known as Tylenol by its brand name, when used during pregnancy. Now, let's reset here with the facts of what we do know and the science. Acetaminophen is currently considered the safest pain relief option for pregnant women. Administration officials now are advising women, however, not to use it early in pregnancy unless they have a high fever. The health secretary saying that at this point there are no other options, so that doctors should still use their best judgment, but then went on to warn that they believed as well that this was associated with potential liver toxicity, even claiming it could prolong viral illnesses in children. The administration, as part of this announcement today, is also saying that folinic acid, that's a supplement, also you may know it as leucovorin, is a way to decrease the symptoms of autism. Secretary Kennedy has, of course, previously promoted debunked theories which link vaccines to autism. And he was just bringing that up again moments ago as we were coming on the air here at the top of the hour. The secretary, and just pardon me as I look at my notes here, noting that they are now investigating, in his words, multiple areas of causation when it comes to vaccines. He claims that 40 to 60% of mothers who have children with autism believe that there is some link to a vaccination. The secretary also claiming that these women have been gaslit, he says, by the science, which has found that there is, in fact, not a connection between vaccines and autism. But he is saying now that this is something that he has directed his agencies to look into. Again, he has promoted these theories linking vaccines to autism for some time. You may recall back in April, he pledged that his agency would have answers on the causes of autism this month. He said we would know in September. This announcement already sparking a lot of pushback from medical experts. The chief of clinical practice for ACOG, that's the American College of Obstetricians and Gynecologists, telling CNN in a statement, quote, there is no clear evidence that proves a direct relationship between the prudent use of acetaminophen during pregnancy and fetal developmental issues. CNN medical correspondent Meg Terrell is joining me now. So Meg, I know you've been looking into this for some time, listening as well to what we're hearing here from the administration, from the secretary. What is the science behind this announcement today?
Well, I'm not sure if we've actually heard them cite their specific studies, but it had been thought that they might cite an analysis that came out about a month ago that looked at 46 previously done studies, kind of analyzed the existing data. And the result of that was kind of mixed. And what they said was that it appeared from their analysis there was an association potentially between use of acetaminophen or Tylenol during pregnancy and neurodevelopmental disorders like autism or ADHD, but that they couldn't prove a causative relationship there. So you can say
that's the key. There's a potential association, but there is not a direct link or cause. And part of that too is because there's so many other things happening. It's not really a control in these studies, correct?
That's right. And so if you are taking Tylenol for a fever, for an infection, for pain, and then subsequently have a child who's diagnosed with autism, is it because you took Tylenol? Is it because of the infection, the fever, the pain, or is it because of something else entirely? We should note that autism is thought to be influenced by a lot of genetic factors, as well as potentially environmental factors. It's very complex. There was a lot that we heard from the president that I think had a lot of people kind of taken aback. One thing that I think folks will find potentially problematic is this idea that he suggested Tylenol should only be used during pregnancy for very, very high fevers if you can't tough it out. And it's dangerous to not treat a fever during pregnancy. And so Tylenol is a really important medication to be able to use to treat fever. And so the data don't necessarily support what we heard from the president.
So in terms of, and just remind us, right, the reason that it is so dangerous not to treat a fever during pregnancy is not just for the woman who is pregnant, it is also for the fetus and the potential damage that could be inflicted upon.
That's right. Yeah, there can be safety issues if you have a fever during pregnancy for the developing baby.
So as you talk about, so in terms of, and you're right, we are hearing a lot. I mean, the president's saying, don't take it, saying there's no downside in not taking it. That is not accurate based on what we know from the science and from the medical community.
That's right. It can be dangerous to allow a fever to go unchecked.
One thing he did say that we do know is true is there isn't an alternative. I mean, Tylenol is considered the safest option when someone is pregnant, if they are experiencing pain, if they are having a fever. Secretary Kennedy basically saying, we'll leave it up to the discretion of the doctor, but go with as low a dose as possible.
Well, and that's good medical advice generally. I mean, we've had babies. We know when you're thinking about taking a medication during pregnancy, you ask your doctor about everything, and it's always recommended, especially during pregnancy, but generally for painkillers you shouldn't take a higher dose than you need. The smallest dose for the shortest period of time is always the advice, in moderation, and especially during pregnancy, talking with a healthcare provider.
So a couple of the other things that we heard, and I'm hoping you can help me fact check this from the president, is he was saying that he believes there is no autism in the Amish community, talking about there's no Tylenol. He also said that in parts of the world that do not use Tylenol, he specifically said Cuba, he didn't believe acetaminophen was available there, that there was also no autism. Are either one of those statements factual? Are they accurate?
They, as far as we know, are not. And, you know, one of the things about the Amish thing, this has come up quite a number of times, that was about vaccines. That often is about vaccines. And this idea that the Amish community doesn't vaccinate. That, according to data, doesn't appear to be true. The Amish community appears to vaccinate. There aren't great data necessarily showing exactly how much, but they do apparently use vaccines. They do also have rates of autism. The rates that we've seen in studies tend to be lower than the rates for the overall population that we've seen, but there can be genetic differences, there can be other environmental differences that don't explain that. And so many studies have shown that there are similar rates of autism among vaccinated and unvaccinated children generally. We didn't necessarily expect to hear vaccines coming up today.
No.
We were expecting to hear about acetaminophen or Tylenol. So the fact that that came into the conversation so early suggests that this conversation isn't done. You also heard the president talk not only about mercury, which has been an issue for 20 years, and you know, we could go into it, but aluminum is one of the next conversations here with vaccines.